fine. Yeah. Okay.
Brilliant. So it's my pleasure to introduce Michael Chang, who is the Project and Policy Manager at the Town and Country Planning Association, for a talk now. I'll just go with that.
That's fine, thank you. I was just thinking whether to do a planning lecture or to do one that we normally do at the TCPA, which is introduce music and poetry. And I guess my presentation is a bit of a mixture. Actually, it's not music and poetry, it's just a presentation, it's not a lecture. I guess you can go to your planning department for that. My presentation then really is drawing on the experience that we've done at the TCPA, drawing on our planning and health work over a number of years. And I'll explain that later on as well. So any questions, please ask me during lunchtime or whenever. But for those of you who don't know about the TCPA, we were established 116 years ago as a Garden Cities Association to build both Letchworth and Welland Garden Cities. And now we're a totally different organization. But definitely both Letchworth and Welland, and for those of you who have studied public health history and planning history, were the inspiration for the first Housing Planning Act in 1909, which I think was the first time that medical officers were actually involved in planning process through housing development. So I think we have that historic link, and I'll explain later on about our link with health as well. But now we primarily do campaigning work and projects around a whole range of built environment topics around energy, climate change, different public health and social justice, and those things as well. And we are heavily involved in campaigning and lobbying government to change the planning system. So the recent housing planning bill, which is actually quite significant for this agenda as well, because if you introduce a whole new zoning system to the UK discretionary planning system, the UK conflict, and people don't understand the importance of that for health and well-being. So watch that space. So how do we fit into the network? So I think that is the kind of purpose of the network. And I think firstly I'll highlight the fact that we are here to make a professional difference, to influence and inform positive change, really. So I'll come back to the TCPA's roots. This back in 1938, we had a chief medical officer actually as the chair of the association back then. I mean, think about it in 2015, 2016, if you had a director of public health being the chair of the association, that's quite something to aim for. Back then, it's quite okay to have psychologists, health professionals, designers, artists, musicians involved in the association, and because it's where the Garden Cities roots came from. But back in 1938, this gentleman, he wrote a pamphlet looking at the benefits, the health benefits of Garden City approaches in England, and looking at places like Wythenshawe, which is the Garden City or Garden Suburb inspired development, Letchworth, Welland, definitely, and other locations which were inspired by Garden City principles, versus those areas who weren't built according to Garden City ideas. And he generally found that they had better health outcomes for people living there than those who weren't living in Garden City inspired locations. But that is a quote from his pamphlet back in 1938, and I think we can all recognize that today, and that's what we're still aiming for, a few decades later. So I think we do have a shared background with public health professionals. And so I've been looking at our projects, and we've done a series of projects primarily aimed at actually local authorities, both public health professionals, planners, and others as well. We began really in 2009 with the JSNA work, and at that time things were beginning to change in health systems, so I think we were trying to recognize the fact that we can use the JSNA, the Joint Strategic Needs Assessment, and planning processes in a better way than they were being used. And actually, in 2015, they did not being used very well, and I'll explain later on as well. Back in 2012, when the systems were changing, were being changed in both planning, we had a National Planning Policy Framework, we had the Health and Social Care Act, and so we produced a document in the middle looking at how we integrate those systems and structures. And in 2013, planning healthy places, and then last year, planning healthy waste environments, looking at the way that we can specifically work together to improve health and well-being of people and places. And so we worked primarily with local authorities, and these are the local authorities that we've worked with in the last 2 or 3 years. I can tell you, each one of them are all different. I can't say there's one approach. All of these local councils, they're all very different in their political structures, their aspirations, the policies, and can go on and on. And data, that's a different issue as well. No one's doing very, very similar things around data. Other areas might look at the JSNA in a very positive way for planning, but others just not referencing JSNA planning decisions. So, it's quite a conflicting picture across the country, but we have the experience and insight from these local councils looking at planning in place in the built environment. So how does the network link to planning, the planning system, planning process? I'm not going to explain the planning process. I guess you can talk to your planning professors about it. But there are a few things really. There's two processes that we don't remember about planning. Firstly, planning is a visionary process looking at the quality of place, people's environments, people's lifestyles in the next 15, 20, 25 years. And that is in the local plans, and we always forget about it. Most people get engaged in the planning system through planning applications, your neighbours extending a house or a garden or whatever, and you get involved in that. And that's how people perceive planning and planners. But we have a much more visionary role to plan forward, and that's where I think the data, health professionals can actually help engage in the process and make sure that 15, 20 years, 25 years later on, the fact that we are planning for them now, we will have made an impact in that time. We're not thinking about it in that way in both planning and other professionals. And the other second thing is obviously planning applications. We get involved in responding to a household extension, urban extension, and that's fine, but everything is quite hierarchical in planning. Everything's influenced from top down. So if you have a policy around health and well-being, it will generally filter down to planning applications. If you have a very weak system around health policy and local plans, it doesn't quite tend to filter down. And it's quite a generalized picture, but that is generally the case in planning. We work very top down. So what do national policies say about obesity, health? Well, that is what planning practice guidance say about health and obesity as well. And these are the kind of things that we think about. If you think back to 1938, these are the kind of things that we have been thinking about, but it's just more out there in national planning policy. So we have to actively now pursue and consider these factors in planning policies. And so that's quite straightforward. And then evidence, that's quite straightforward. National planning policy frameworks say that actually we have to take into account evidence in plan making. And so the fact that a lot of councils don't actually formally or actively think about the JSNA and their local plans could be considered not compliant with policy. But then again, a lot of evidence around open space, active travel, access to healthier foods, that's all in different professionals' interests, environmental professionals, travel planners, so it's not just health professionals who actually have the data, but we're just not engaging health professionals in specifically thinking about health and well-being impact. So the JSNA then, the first one, that document that I mentioned earlier back in 2009, our recommendations were that obviously things need to be more joined up. We need to think and use the JSNA a bit more because it's what you have to provide as a local authority at this time. And so why aren't we using it a bit more? Why aren't we first of all referencing it? That's the most simple way of using it. And why aren't we pulling data from it to inform both plan making and our planning decisions? And issues are around, well, we can't use it because when certain numbers, we can't identify places. It has to be spatial. We have to kind of link places to the impact of development. And those issues are quite actually very, very important for planners. And the second kind of bullet point is about research we've done with London boroughs looking at both their local plans and the health and well-being strategies. And the fact that they don't actually reference, a lot of them don't actually reference JSNA, doesn't mean they're not considering health and well-being. It's just that they're not using the data most effectively in those areas. And so, my question to you then, in a very interactive lecture kind of way, so how many of these is actually all or not off? Who thinks that all of this is evidence, or some of it might be evidence, or none of it is evidence? All of it is evidence? Hands up. All of it? Some of it is evidence for planning? Hands up. Good, thank you. And none of it is planning evidence? All right. The question is, everything's evidence in planning, obviously, because obviously everything related to the use and development of land is evidence. Even ministerial statements, a minister saying, we would like to prioritize obesity in planning, that is evidence in planning. We have to take that into account. Obviously, by taking it into account doesn't mean that the outcome would be that we have an obesity policy. But the fact that people say things at a ministerial level means we have to take those things into account. And everything that you do and that we do everywhere that anyone does in academia, practitioners, consultants, we have to take into account. We have to be relevant to that place and that situation. So that's the complexity that we are facing with in town planning. And so if you think about the Planning Healthy Weight document that we did last year, think about all the things like open space, movement, food, local economy, all of that have a series of evidence-based big data assessments that we have to think about and balance when we make a decision on a planning policy or on a site-by-site basis. And so, again, you're thinking about a place. So if you think about a place like this, to some extent, you have to consider the benefits and the disbenefits and the relevance and non-relevance of certain interventions around cycle lanes, faster takeaways, open space. In some areas, potentially a cycle lane is not the best option, but public health tend to consider, well, we're going to cycle lane here, we want to borrow a bike in this private community. But that still doesn't work like that. You have to think about the place and the people. And I think public health have a great engagement with people side of the things, whereas planners were quite good with place. And I think it's about joining these two things up so we actually make a real difference on the ground. So what do we need evidence to do in planning? Obviously, we need, they need to be relevant. We need to have a purpose for having evidence. There's plenty of evidence out there, as you can see, when you go onto the planning portal, looking at planning application, there's bucketfuls of evidence supporting planning application. And we need to question ourselves why we need to use it. If we need to support an intervention, a policy, then we go and find evidence. All evidence is influenced by whether we make choices or actually our policy choices are made because of evidence-based. I think we need to be very, very clear at the local level why we need an evidence and what we need it for, and so why we're going to use it, where we're going to use it. And I think the issue around evaluation monitoring is really important because we don't evaluate as well as we should in town planning. But the fact that we actually do have statutory monitoring mechanisms in planning for both local plans and planning decisions means that actually there are ways to get in there at the moment to try and make the best use of what we've got. So what gets measured gets attention, obviously. If we don't have an indicator around it, it doesn't get any attention. So I think we need to be very, very clever about that. So collaboration for shared evidence. These are some case study examples that we come across in the workshops that we've done. And this is Worcestershire. And they've taken a very unusual step as a county to not actually use a JSNA in planning. So they come across, they didn't do this in isolation, by the way. They actually did it together with health and social care colleagues. So they produced this technical paper for planning that can actually be used. Is it a fire alarm? I think I should probably wait. Any questions? Stop. Okay, that's fine. No questions then. Okay then. Back to the slide. So, okay, this is a piece of work that they've done to actually pull together health evidence that can help inform the planning system of each of the districts. And I kind of quite surprising because obviously that's what JSNA is there for. You can review your JSNA, you can tailor to the fact that you can, we can actually use it in planning. There's no prescriptive guidance around what a JSNA can and can't do or what it can and can't include. And that is one thing I find surprising about the health policy system versus the planning policy system. The planning policy system is very prescriptive about what we have to consider in planning, whereas if you look at the JSNA guide from DH, it's quite, I won't say flaky, but it's very high level, it's very open-ended as to what we can actually include in JSNA. But they've done that, and that helped inform their engagement with planning colleagues and how they actually take into account health evidence and planning policies. And I don't know how that's working, by the way, because it's an ongoing initiative. And so we need shared evidence. Obviously, JSNA will be a good way to do that. And then that has to lead to a shared policy action around health policy or anything along those lines. And this one is about looking at exactly what we need health policy to do. And so Vicky mentioned things around fast food takeaways. Yes, if there's a case for having a fast food takeaway policy, then it's fine. But we know councils have actually gone through the evidence-based process, examined the evidence base for having or not having a fast food takeaway policies, and was saying, well, actually, we don't actually need a fast food takeaway policy because it's not a priority issue or it's not an issue that can be addressed just by planning. So, yes, I will go through the fast food takeaway policy issue, but I think it's not a one-size-fits-all. Not all councils will adopt it. I'm not suggesting all should adopt it. It's not an issue for everywhere, and it's definitely not one of the things that you only need to do to take the obesity levels through takeaways and retail. But again, mapping is really important. I would suggest that mapping is probably the most important way to present evidence to town planners, because that's where you can identify where you can take the action. And if you are really stretched for capacity and health teams and planning teams, then identifying exactly where you can prioritize your interventions is really important. That you can say, well, everywhere else where they don't have a really significant health issue, then we'll leave that for now, but we'll prioritize working with the most deprived communities or the areas that have really high obesity levels, and I think it's really quite important. But there are different ways of doing mapping. So on the right-hand side, South-Tyne side, they mapped deprivation data against hopeful takeaways and where they are, and they might be thinking about doing a policy around exclusion zones around secondary schools. Haringey on this side looking at healthy eating or health action zones, and then similarly in Gateshead, what they've done in Gateshead, as some of you might know, they've effectively put a moratorium on new fast food takeaways, basically saying we've mapped our obesity data against hopeful takeaway locations. Any new fast food takeaway locations within a high obesity, childhood obesity ward will not gain planning permission, and that's the whole of Gateshead, basically. And I think for that, for council to take that kind of risk initiative is really quite encouraging. But obviously, the question I put to town planners, as I would as a town planner, is how would you deliver it, how would you implement it? And the planner was saying, well, actually, we'll see in court. Because they will be challenged by developers, but they're willing to take that risk and use data to back up the policy decision to say, well, actually, we need to tackle obesity now, and we're introducing a policy on fast food takeaways, and we'll see developers and those in court and see whether we can get that through the planning system. So it's quite so watch that space. So what kind of policies are we aiming for? So you have your shared evidence, you have your shared policies, aspirations, and then what kind of policies do we actually need in planning to make it really effective. You don't want a policy that just says, because of evidence, we want a blanket ban on fast food takeaways or anything like that. We need a specific policy that says we want a blanket ban in proximity to X, Y, and Z. So these are actually, A and B are actually from Gateshead's policy. So they will not approve planning applications for takeaways in a location where there's high childhood obesity levels, and it's quite a very aspirational move. Maybe not deliverable, but it's quite aspirational for planning policy. And so we need to have, obviously, shared evidence, shared policy need to have go towards a shared kind of outcome. And so I think these are all the kind of words that we associate with. We need healthy cities, healthy communities, active counties, and all that all linked together. And I think we're hoping that we all are working towards a shared outcome. And I mentioned Healthy New Town here because obviously parallel to the obesity system, whole system approach project, NHS England is introducing a whole new initiative called Healthy New Town. And this is very similar to, if you like, this is the health version of the Eco Town or the Garden Cities initiative, where you're looking at healthy development and the new ways of providing health and social care services. Again, watch this space because we don't know how that links up with all the other things that we're doing, but it's definitely very exciting. And I have to show the slide, and I think it's quite funny. As a town planner, we look at it, and people laugh, and they say, well, that's a really bad development. Well, actually, I'm thinking, well, as a town planner, I mean, don't blame planners for this, because obviously we have to think about different things. It could be an old building, so we're retrofitting it. It could be car parking on the ground level, we can't change that. It could be a ground floor retail. Flood risk, we want people to be outside the flood risk zone, so they're on the first level. Access, obviously escalators, discount the people there because they're obviously not disabled to some extent. So I think there are all these different issues in planning, and it doesn't mean that we're not thinking about obesity or health and well-being. It doesn't mean that we haven't used health evidence to inform that decision. It's just that we are balancing different conflicting interests, and the decision is made to actually have that on the first level rather than the ground level. For some reason, I don't know. It's an American case, obviously. It might not happen in the UK, but it could happen in the UK for various planning reasons. So, don't think about it on face value. Planners, we have to balance all these different interests. So, be kind to town planners, please. Okay, so what do we observe about the nature of evidence? And that is a quote which I think you can all read about about why we actually need planning and so why we actually need evidence to support our planning decisions. And we're facing competing evidence and priorities here, so we really need a guidance for us to make a decision. Planning is a delivery tool for health and well-being. We're not here to make a judgment. We're here to make a judgment based on what your evidence tells us to do. And so that if we have conflicting evidence, in some ways, harmful takeaways, obesity, there are a lot of conflicting evidence, and then we are struggling to kind of make a decision on certain things. So certainty and uncertainty definitely will be very, very useful for town planners. So our aspirations for the network. Okay, another question then. Which of these do you think, on town planning terms, which of these do you think, for those who aren't town planners, please don't answer this question, for those who are town planners, can help me here. Which of these options, there's a fire alarm again, I'm losing my presentation. Okay then, question then, think about it. Which of these are legally compliant in town planning terms? Do you have the evidence that inform your policy choices and your decision, or do you have decision by elected member and then telling your planners go and find evidence and then you have policy choices, or you have policy choices, planners come up with scenarios, finding the evidence and then a decision? Which one do you think is legally compliant? The first one, hands up. Thank you. The second one, hands up. Third one, thank you. They happen. Actually, they happen across local authorities quite often. The one that's legally compliant is obviously the first one. We have to have the evidence base, and that informs our scenarios, our decision options, and then we carry on from there. But we know planning is a political tool, and we can't hide from that. And I think our challenge in town planning is to make sure that we balance the political aspirations of elected members and politicians versus what you actually give us an evidence base. So it's very clear that we need a very clear evidence base with conclusions to help us back up our decisions, that we can get to the planning system and get to the courts. Otherwise, it could be very, very expensive for local government. Right, okay, so finally then, planning is obviously an art. I've demonstrated that planning is a visionary tool for the next 15, 20, 25 years. We're here to make a difference. We're not here just to prove our household extension. We are here to make a real difference. So please, think of town planners as a really exciting profession, not just boring old planners like you see on TV. But it's also a science. We have to balance evidence-based with art. We have to think about where people will love the trends, the projections, and that's where the data can actually help town planners. And then finally, obviously, you can't beat relationships, because a lot of things are actually out there at the moment. The fact that we're here today is really useful for us to know who's doing what, who's not doing what, and where the gaps are. And so this is where relationships, informal and formal, are really quite useful and actually quite important for planners to do their jobs properly. And that's my presentation. Thank you.
Well, thank you to Pinky and Michael for their interesting talk. And we're now having a kind of distinct shift from policy over to data, and I'll hand you over to Mark Birkin, who is Professor of Spatial Analysis and Policy here at Leeds, and also Director of Leeds Institute for Data Analytics.